Hey everyone, today's topic is what makes up a plastic surgery price quote. So you've decided you want a breast augmentation or you've decided you want a plastic surgery procedure. Now what? Now you got to pay for it, right? So you go in, you see the doctor, you're great, you love the doctor, you decide you want to have surgery. And now it comes down to having to pay for it. So typically in most practices, including ours, the patient care coordinator will then take you back to their office and they'll give you the price quote for the cost for the actual operation. Well, in that cost, there's actually a breakdown of what makes up that cost. And today I want to kind of go over in this video what typically makes up the cost of plastic surgery. This is how we do it in our practice, and most practices do it this way as well. So this is a pretty good overview for how it's done in the plastic surgery world when it comes to the cost of your surgery. So there's usually four components, and the first is the OR facility. So again, standard operating room over here, and there's a cost to operating in a facility like this. And that cost includes the cost of disposable equipment. You see in those glass shelves, there's all this equipment over there, and there's sterile equipment, there's bandages, there's dressings, there's a nurse, there's a scrub tech and a circulator, and all that is bundled into the cost of the actual facility. Whether that's facilities in the surgeon's office or whether it's in a hospital, there's actually a cost for that. So that's the first thing. The second thing is the cost of anesthesia. So someone's got to put you to sleep, and a board-certified anesthesiologist, which is what we use in our practice, there's a cost for that as well. And there's also the cost for the drugs that are required to put you to sleep, whether it's general anesthesia or IV sedation. That's the second cost involved in the total cost of the actual operation itself. The third is implants and materials that are required to have your procedure. Whether those implants are breast implants or chest implants or calf implants, or in the example of fat grafting, so the BBL or the liposuction or fat transfer to the buttock, there's a certain cost of that equipment as well that's required in order to have your procedure. Sometimes in certain breast revision cases, we use acellular dermal matrix and certain types of special mesh that's required, and so that comes under that as well. And so all that for your particular procedure will also be line itemized in terms of that as well. The fourth part of the cost is obviously the surgeon's fee. So the plastic surgeon is going to charge his or her professional fee to do your operation. And obviously that varies from surgeon to surgeon and practice to practice to a certain extent. So those are the four things that make up the cost of surgery. Now, when you're price shopping or when you're looking at different quotes, remember we talked about in the last video, focus on quality, not price. Typically, many of these costs are reasonable within a specific market. So if a price again is very, very cheap and you're noticing that the price is very inexpensive, there's probably some shortcomings in any of those four line items that we talked about. You don't want to skimp on the facility, you don't want to skimp on your anesthesiologist, and you don't want to skimp on the supplies, and you don't want to skimp on the experience of the surgeon. So those are all the four things that make up the cost of surgery. So again, focus on quality, not on price. And you'll do fine. So as always, thanks for tuning in. If you like this video, please share it with others. And if you have any questions, leave it in the comment section below. You can follow us on Facebook and Instagram. As always, thanks for tuning in, and I look forward to the next video.